And for more on this, we're going to bring in now Beverly Hallberg. She's visiting fellow for the Independent Women's Forum and president of the District Media Group. Also, Joel Rubinstein. He's Democratic strategist, former Deputy Assistant Secretary of State under the Obama administration, and president of the Washington Strategy Group. So, Joel, I'll start with you. Why do the Democrats have a problem with President Trump and his administration wanting to repeal Obamacare or their efforts to do so?
Well, Arthel, it's very straightforward. If this lawsuit is successful in court and the Affordable Care Act is terminated, Americans will die, and there will be blood on the hands of the Trump administration for doing this, because the Trump administration will have had zero replacement to protect these Americans. We're talking about 20 million Americans being kicked off of health care. We're talking about a termination of protections for pre-existing conditions, an issue that Democrats used effectively in the 2018 midterms, where Americans overwhelmingly expressed support when they were voting on health care for the Democrats.
So Joel, do you think
this is a high ground here?
Joel, okay, this is the high ground here. Do you think, Joel, the Democrats would be willing to sit down with, revisit this with President Trump and maybe come up with something that would work for both sides politically and for the people, most of all?
Well, one can always improve and build on the current healthcare system as we have it, but you don't need to throw it out and then restart it. Speaker Pelosi is already talking about new legislation. Leader McConnell has not yet introduced anything, but where's the bill? A decade of discussion. The Republicans need to put a bill forward, and let's have the legislative process work it out. Absolutely. But you don't need to throw it all out when there's nothing to replace it.
But Leader McConnell did say, quote, "I look forward to seeing what the president is proposing and what he can work out with the speaker. I am focusing on stopping the Democrats' Medicare for None scheme." Now, we don't have the Democrats to back up that particular part of the quote, but I do turn to you, Beverly, and ask you, going back to the Republican side, do the Republicans have a viable backup plan to replace Obamacare if that's what they really want, to just tear up all the paperwork and come up with something new?
Well, there have been a lot of discussions since the failure of repealing and replacing Obamacare in 2017. There is no way around that. That was a big loss for the Republicans when they couldn't get it past the Senate. Of course, now you have Democrats who can take control of the House. So I see this as a long-term effort. One of the things that even the president mentioned in the clip that you showed is that pre-existing conditions will be covered under the Republican plans that I've heard of. One of the reasons why they weren't successful in 2017 is the Republicans agreed on repeal. They didn't necessarily have a replacement put in place. So I think there's been enough time. There are groups that are putting together a plan that I think from a bipartisan standpoint could get some traction, but that's not going to come till 2020. What I do think you can have in the meantime is something that Congressman Mark Meadows has put forward, which is doing a piece-by-piece approach until the 2020 election, and that could include things like drug pricing. You can have a lot of bipartisan support on certain areas of health care.
Right, and you're talking about the politics of it, Beverly, which of course that's what this is about in many ways. You know, you've got the president repealing Obamacare back on the front burner, and now saying the GOP can become the party of great health care. So is that why now? Because we're really ramping up for the 2020 re-election campaign?
Well, what you find even in polling is that many people still dislike Obamacare. The question is, what replaces it? How do we fix it? So
well,
I think
that is the question. So why is the president saying, get rid of it? And then we'll figure out something on the other side.
Well, he's saying get rid of it. There's even a reason why Democrats want to get rid of it. Even Nancy Pelosi has a plan. It's because Obamacare isn't working. We need to have a fix.
President Obama actually said Obamacare is not perfect, so they want to fix it.
Democrats did not want to have Obamacare, the Affordable Care Act, repealed. We don't want to have it thrown out in courts. We don't want to throw our health care system into chaos. We want it to be improved as it should be, but the way it currently exists is protecting Americans' health better than it was before. And if there are suggestions to improve it, absolutely. 20 million people more on health care is not an improvement. Protecting people from pre-existing conditions.
One of the things that's important to bring up is especially people. What's really important is when you think about there are about 7% of the people in this country who are struggling to even figure out whether or not they can afford their health care because it costs more than their rent and their mortgage. While this has helped some, let me finish. While this has helped certain people, there is coverage. I would still debate you on the quality of care that they're receiving. What you do find is that people in the individual market, small business owners.
What does that mean, Beverly? Excuse me, what do you mean the quality of care? I'm just saying, I mean, from just from
There
somebody
we
who
know
is,
that
look,
there
we
are.
What I mean, let me finish. We are very fortunate that the three of us sitting here, we have health care, and we can
Correct.
choose where we go, when we want to go to get that coverage. So I just wanted you to clarify for us what you meant by, well, they have coverage, but the quality of their care is.
There have been plenty of reports. Yeah, there have been plenty of reports where you see that hospitals, small hospitals are shutting down, where doctors are choosing to not continue in the industry, and that you also have that people are having to wait longer to get quality care. So I think we have to make a difference between having insurance coverage and also putting that against having quality care. So that is a discussion. It's not just about how many people are covered. It's are they actually getting the health care that they need?
Joel, listen, there are many doctors are shutting down their doors due to the corporatization of health care and the exorbitant amount of malpractice law insurance they would have to pay for. Those premiums are skyrocketing. What is the Democrats' political, and frankly, Joel, their campaign counter this? Because they can't just keep saying, well, we need to fix Obamacare. How are they planning to do it, specifically where the folks can understand what it is that they're proposing?
Yeah, so primarily, Arthel, costs were skyrocketing prior to the Affordable Care Act. The intent of the Affordable Care Act, which was based upon Mitt Romney's plan in Massachusetts, a Republican plan, was to stabilize that cost increase and get everybody under the umbrella of insurance. And that's where Democrats are going. But you're right. There is a vigorous debate right now inside the Democratic Party about how to go further, expand Medicaid further, get more people onto government coverage that could potentially lower costs even further, because this is not a perfect system. But what I'm trying to emphasize here critically is that we do not want to throw people off of health care to somehow improve their health care. That is not how you do this. And we need to see actual legislation proposed by the president rather than a lawsuit about just getting rid of it.
Maybe now Senator Romney can get together with the Democrats and maybe they'll come up with something that can fix Obamacare.
Republicans are putting together a plan. They're coming up with something. I think that's the taking this and saying that getting rid of the Affordable Care Act means that all of a sudden people won't have health care.
We've
is
had
actually
this
not
discussion
bringing.
for
Wait,
10
Joel,
years.
let her finish. Finish, Beverly.
It's actually not bringing to the point that Republicans have gotten together and are working on what does good health care look like. There's a plan right now talking about saying that government isn't the one that can best determine your health care. You actually should make more choices, taking it back to the states.
But you know, people
and
get
having
confused,
more
Beverly. It's a whole other discussion. People get confused when it's not to say that people are not smart, but it's a lot of red tape and bureaucracy to siphon through to try to figure out
I think most people,
and if I may,
most people would
those
rather
are the
be in the driver's seat of
that
their
we've
own
heard
health
for
care.
10 years.
No,
For
you're
10
both
years.
talking. 1 second. Beverly, 10 seconds, and Joel, you wrap it 10 seconds because they're talking.
What I do trust is people to make their own decisions in health care and not D.C., and that's the direction Republicans need to go for people to have lower costs and better care.
Okay, Joel, your last 10 seconds.
Thank you. No, and I agree with that, but the Republicans had control for 2 years in Congress, made no plans, a decade of slogans. They still have no real legitimate plan that can work.
All right, we'll see who has the better plan for the people. Joel Rubin, Beverly Hallberg, thank you to both of you. Thanks a lot, guys.
Thank you.